Hello and welcome to another one of our videos where today I'm going to be looking at the role of glute exercises and what happens when you actually overdo them, if in fact you can overdo them. So let's get into it. So firstly, glutes are spoken about a lot, and we know that they're critical for efficient movement and really strong legs. And they are the biggest muscle groups that you have in your body. So the glute max here, massive muscle, like in comparison to hamstrings and quads, is just huge. And they are really the engine room behind explosive movements in sprinting and throwing and jumping and other sports as well. So, but we also use them all the time in things just as simple as walking, lifting heavy objects from the ground. In all of these instances, these guys are critical for maintaining alignment of the leg as much as moving efficiently with us to just do things in life. So, but they're also known for being very weak and very lazy, and when that happens, that creates a lot of problems for the lower limbs and also the lower back as well. So I've shown this picture many times before, and this is sort of like I'm talking as if it was a foot related problem, but quite often this can be reversed in order. It could be that's number one, that's number 2, 3, 4. But the glutes, or the hips and pelvis and the feet, work very closely together to create optimal alignment of the leg for, like we said, for running, jumping, walking, just standing still. So with these guys being quite weak, they don't resist the hips and the adductors of moving the body into like internally rotating and turning the pelvis into an anterior tilt. So, and that sets you up for problems like these of anterior cruciate ligament tears and patella tracking problems around the knee. All right, so we know the glutes are key to this, so it makes sense that they need to be strengthened. So, but before we get into that, I'm just going to quickly touch on there's 3 different roles of the glutes. So a lot of people just sort of associate it with thinking that it just does one thing, when it's sort of got like a multi-layered approach. So the glute medius, which is sort of the top one and the one that's really heavily used in the single leg stance, sort of has a couple of unique roles. So the posterior fibers contract at the early stance phase to basically lock the ball of the femur in the hip socket. So this means it's basically performing a stabilizing role or compressing role for the hip joint to sort of keep everything exactly where it's meant to be. The middle and anterior fibers of it run in more of a vertical direction and help to initiate the abduction, which you would sort of be normally seeing with a clam type exercise, but it happens like with, say, something simple like getting into your car, for example. But a lot of anything that's a sort of a lateral movement, it's going to be heavily needing to do this role in addition to this role. So it's sort of, so I know it sounds confusing, but this comes back to how you're choosing exercises and things like that, which we'll touch on later. The anterior fibers allow the femur to internally rotate, so it has to do the opposite of this as well. So if that's externally rotating, it needs to be able to have the ability to internally rotate. If it loses that, then you're also going to have lots of trouble, and that's when you'll see hip impingements and things like that, and disc bulges into the lower back, because you just lost the ability to internally rotate. So it's sort of got a multi-layered approach of how it's meant to be used. So keep that in mind when we're talking about roles of exercises. So it makes sense that we've got to strengthen them. So common thing, bridge hip extension, whatever you want to call it, a bit of a harder version with a Swiss ball and single leg, a deadlift and a single leg deadlift, all great exercises. And we would use them quite a lot all the time, but how we use them and then the cues that we use within them are very important. And some people we may find may not need to do these and may actually need to loosen, believe it or not. So can you overdo it? Absolutely you can. Too much is just as bad as not enough. So you're always striving to get balance. So if this is out of balance, we need to get something over there, but I don't want all of them over there. All right, so if that was the weak glute and we just overdid it, and then we really just end up with the same thing but just on the other side. So it's all about just trying to get everything to be working efficiently, smoothly. All right, so this leads us to what is known as butt gripping. So when you overuse the glutes or you've incorrectly programming them, This is where it's been given the term butt gripping. You can reference Dianne Lee. She's the sort of one that's really coined this term, I suppose. And this is common. I've seen this a lot recently. So this is what it looks like when you see someone who's a butt gripper. Almost look like they don't have a butt, and you'll see these little divots in the side of their butt cheeks here, and sometimes you'll even see like a wedgie, I suppose you could say, where their fabric of their pants is actually going up their butt crack, so to speak. So, but this is like a real giveaway that this person's got a glute dysfunction of gripping all the time. They can't actually let it go. This person normally will have a lot of back stiffness. They'll find it very difficult to touch their toes, and they will have possibly some hip problems going on at the front of the hip, which would be like pinching and even groin strains and things like that, because basically they're pushing the femur forward. So as I just mentioned there, so the butt gripping results in the femoral head being pushed forward and out of the hip socket. So you'll see that poorly on lunges, and this person probably even stands in that position, which I'll show you in a minute. So hip impingement's a very likely cause of someone doing that. Piriformis muscle is actually another thing that can result from overdoing glutes, believe it or not, because we talk about this a lot with being weak glutes, but they can actually become weak because overusing them actually stimulates the piriformis muscle, which then inhibits the glute maximus, and he basically does less and the piriformis does more, and then you end up in trouble. And basically the end result of both of these is the poor hip mechanics, and we'll often see that with bending. Like we said a minute ago, these people really have a hard time trying to touch their toes and learn how to use their hip to do the hip hinging action, protecting the back. They're just in a gripping stage, so that they have no choice but to move their spine, and that's where we'll see herniated disc injuries resulting from that. So one thing to never use when you're doing exercises, and I was guilty of this for many years, used to think it was great, don't tell someone to squeeze them hard. You can use the cue of activate your glutes, just squeeze your butt cheeks, I suppose, but don't tell them to do it excessively, like really crank it, because that's how you're going to create problems, as we've spoken about here. So poor technique how's it created? So poor technique with hip stretching, for example. So this is an example where you're basically just cranking that femur out of the socket. It's not remaining in there. So you need to maintain, and you'll always, it's a giveaway because there'll be too much extension through the lower back. So this is actually not really stretching the hip flexors as much as it's just really ruining movement. So you've got to make sure that the pelvis remains aligned in more of a neutral curve, neutral pelvis. Poor technique with deadlifts. Now, on the end phase, when someone stands up, and this is where the cue, squeeze your butt hard, that's what it looks like when they do that. And again, see how this is very similar, the same sort of thing is happening. And this person who does that will find it very hard to pick it up correctly, because they're just pushing their butt so far forward they can't actually get it to rotate backwards into an anterior tilt. This person may need a block to lift the plates up off the ground and really learn how to do Romanian deadlifts for quite a while. So glute and hip stretching may be a big factor, more so glutes than the anterior hip here, all right? Because this person actually needs to release the glutes, not actually tighten them. So incorrect programming. So overusing glute isolation exercises like the clams with too much time under tension, too many reps. Understand that the glutes are very much designed for powerful movements, so to lift heavy things really quickly, to sprint, to jump. These are things that are done in quick timing, not with really slow tempos and holding patterns. When you do holding patterns, you're going to encourage muscles that are not the glutes to come in and take over, being piriformis muscles, ITB, TFL, hip flexors, all these guys that's what their job is, that they're really going to come in and try to do those things. So you might have a good exercise, but the way you're doing it is now going to completely ruin how it's meant to work. So as I mentioned before, the excessive amounts of repetitions will actually get this guy firing up. All right. Always remember, these exercises are stepping stones to integrated movements, nothing more than that. If you're able to, if you don't have pain and you can do deadlifts and lunges and squats, just do deadlifts, lunges and squats. Don't fart around with these things, because you probably might disrupt the timing of something that's really good. So If you're able to, do them. If you're not able to, start with these, but eventually try to get to them. Right, that's the key. You want to get to them. Habit and unconscious gripping is another way that it can be created. So this is where, you know, you're standing in a posture like this. This is, again, see how it almost looks like that deadlift person before, where she's pushing her hips too far forward. A lot of people just stand without realizing they're doing this, and they're actually in a state of constantly squeezing their glutes, and they've just become used to it. Even worse is the person who actually deliberately does it, believing it makes them stronger. Do not do that if that's you. You just avoid doing that. That's really bad. So try to maintain a neutral tilt with your pelvis, so it'll be tilting forward, not sucking under. Sitting poorly, like with your bum sucked under for long periods of time, is another way to create it. And you won't know that it's happening. It'll just be building up from your repetition of doing it all the time. One way to know if you're unconsciously gripping, you can stand up, place your hands on the sides of your hips, just behind the bones. And if you feel a big divot under your hand, then you're a butt gripper. And if you can't relax your butt muscles and change it any further, then you're definitely a butt gripper. Another way you can do it is you can try and lift your knee towards your chest. If you lift your knee and you only get a certain way and you already roll under, again, you're a butt gripper, and you're always going to find this person's going to find deadlifts hard. You should be able to lift this knee up towards your chest, but maintain this. All right, and that means that you're keeping the ball in the socket. Where see here, it's moving out of the socket, sort of coming forward, and that's where you're going to get pinching through the front of the hip. Another way you can sort of test it, if you sit on a chair and you always roll back, like we spoke about it before. These are all telltale signs that you're a butt gripper and you're doing it unconsciously, and you're going to have to be aware of it and then try to overcome that with conscious correction, I suppose. So with our exercises, we want to, like I mentioned before, isolate to integrate. So we might use the clams, we might progress it to a sort of a standing monster walk or crab walk if you want, and then even a single leg one. These are sort of purely isolated, moving into an integrated isolated. And then on this side we've got the lunge, the one leg squat and the lateral lunge, and then the deadlift in the middle. All of these exercises are great glute ones. I just don't really want to fart around too long with this one. Even with this one, I sort of want to try and move to how it would really be used, and try to get it to load, or I don't hold it for long periods of time. I get it to function with its partners of the quads and the hamstrings and adductors and all the other hip muscles, and it does its job and it switches off. So it goes from really on the job to relaxed. I don't want to be gripping all the time, right? That's what sort of ruins the timing of it all. So the tempo, the sets and the reps. Isolation exercises can handle more reps, but don't encourage excessive holding patterns. So don't hold them for 10 minutes, and I've heard some people say that I have to do this for 20 minutes every day. Well, that is just going to ruin you. Don't do that. It's really bad. So for example, if I'm doing clams, I might do 2 sets of 20 reps, but I won't go for like holding of each one. I won't want to do an excessive amount. And once it looks normal, I want to progress to to a standing movement or other things instead. Increase this. I might increase sets and decrease the reps. Encourage smooth movement and timing. So with the integrated movement, so for a deadlift, for example, I'm going to do more sets than the clamp. I'm going to do 3 to 4 sets, and I'm not going to do 20 reps with it. I'm going to probably keep it 8 to 12, and probably, to be honest, probably keep it 6 to 8, even maybe 4 to 8 sometimes, because then it encourages the timing of how it's meant to work. Then I would also learn how to engage it in single leg stance, the lateral abduction, and also lifting it, like with jumping and stuff like that. And then moving towards the step-ups and hopping drills, and trying to engage it again in fast timing where it has to switch on and switch off. And that's how it's meant to be used. And if you do that, you'll have great glute strength, but you won't have the issues of gripping where you've just disrupted how you've created your strength. All right, so I know it can sound a bit confusing, but I see this a lot, especially with people with hip dysfunctions, with lower back and hip problems and piriformis thing. They've sort of got the right exercises, but they're just doing them poorly. All right, so if you're a butt gripper, like I said before, you will need to change your habits first. You sort of need to acknowledge that you're doing it, and then try to become more aware and stop doing it. You will need to be stretching of the glutes to try and get the center of the center of the head of the femur back into the hip socket. So we recently put some stretches on the YouTube channel on how to do that. And probably the best exercise is the Romanian deadlift, where you're trying to push it back into the socket while you're bending and keeping your neutral curve. All right, so these things here are great ways to sort of help that butt gripper, as long as they're changing their habits as well. All right, so if there's any questions or comments that you want to know, or check out the description under the video. I've put a few links of things you can check out. We've got heaps of free reports and with all the ideas on how to put all these exercises together. So make sure you check out our website. Again, look in the description because I'll chuck heaps of stuff there for you. Alright, so I hope you enjoyed that video, and we'll see you in the next one.